The impact of the governor's proposed budget on hospitals in Pennsylvania. Next on Behind the Headlines.
This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Welcome to a new edition of Behind the Headlines. We're on location today in Pottsville, Pennsylvania, meeting with the CEO of the Schuylkill Health System, Mr. John Simodejka. Welcome.
Thank you.
We want to talk a little bit today about the governor's budget, its impact on hospitals across Pennsylvania, and we have one of our leading experts and also a board member and executive committee member of the Hospital and Health System Association of Pennsylvania. So welcome.
Thank you.
Well, why don't you start a little bit and tell us a little bit about the Schuylkill Health System.
Schuylkill Health System was formed in August of 2008. Two hospitals that located here in Pottsville, Pennsylvania, Pottsville Hospital and Warren Clinic and Good Samaritan Regional Medical Center, formed a new system, now called Schuylkill Health System, that now makes up Schuylkill Medical Center East Norwegian Street and Schuylkill Medical Center South Jackson Street.
Do you have a nursing school too here? I saw that on the way in.
We do. We've had from 1895, we've been able to educate nurses here in Pottsville as part of now the Joseph F. McCluskey School of Nursing here at Schuylkill Health. We're proud of that. It's one of the longest running contiguous diploma schools of nursing in the state of Pennsylvania.
Oh, that's excellent. Now, what are the biggest challenges facing the CEO of any hospital in Pennsylvania right now?
Definitely, I think everybody would put the number one issue is decreasing governmental reimbursement for programs like Medicaid in Pennsylvania and Medicare on a federal level. I think many times people don't understand that how we get paid in general is through insurances like Medicare and like Medicaid. And in our case, in Schuylkill County and Schuylkill Health System, that's about 65% of our business comes from those governmental payers.
Wow. Now, I mentioned that you are on the board and also executive committee member of the Hospital and Health System Association of Pennsylvania. And we wanted to talk a little bit about what the Hospital and Health System Association does in Pennsylvania. Sure.
Also known as HAP. And,
yes.
And HAP is the largest advocacy group for hospitals and the people they serve in the state of Pennsylvania. They represent acute care hospitals, behavioral health hospitals, psychiatric hospitals, rehab hospitals, all over the state of Pennsylvania. Over 200 organizations are part of HAP, and they are the advocacy group both in Harrisburg and in Washington for issues involving hospitals.
So when it comes to reduced funding from Governor Corbett's proposed budget at this point, HAP would be right in there fighting for hospitals like the Schuylkill Health System.
That's correct. That's correct.
Okay, so you mentioned briefly we've got some Medicare and Medicaid cuts, and that's one of the biggest reimbursements that you get. Tell us a little bit about the impact or what Medicaid and Medicare means to Pennsylvanians.
Well, from Medicare program in general is a program for the elderly. It's a federal program, people 65 and older. That's how most people in this country, 65 and older, get their health care benefits, is through the Medicare program. And that's one of the entitlement programs that people hear so much about in the press. And when the press is talking about entitlement programs, it really comes down to Medicare, Medicaid, and Social Security. And Medicare is the one for the elderly, federal program. Medicaid is actually a joint state and federal program. And it's also, again, people don't realize that over half the dollars that come into Pennsylvania associated with Medicaid come from the federal government. So when there is any corresponding decrease in payments or reduction in the budget associated with Medicaid payments in Pennsylvania, that means we're going to be getting less federal money coming back into the state of Pennsylvania associated with that.
Well, so if Governor Corbett's proposed budget has reductions in Medicaid, is that coming from the federal level, or are those choices that are being made on the state level?
No, this is choices on the state level.
Okay.
So that when the state is looking at many cuts to Medicaid type of programs, and hopefully we'll talk a little bit about some of those programs today, but in general, number one is related to a proposed 4% cut to hospitals and to nursing homes for 4% cut in Medicaid payments. So when those 4% cuts come, that'll be a combination both of state and federal reimbursement changes that will come to hospitals and nursing homes.
Well, let's talk about the types of programs that are covered by Medicaid.
I think that's also a misconception and not a full fact that the public has related to the Medicaid program in Pennsylvania. And Medicaid in Pennsylvania, for the most part, the number one area that the largest portion of the state budget associated with Medicaid is for long-term care for senior citizens in nursing homes. So if the person's income level is low enough and they don't have resources to pay for long-term care in nursing homes, that's who's paying for it. It's Medicaid. So I think many times the impression is for people throughout the Commonwealth to believe that Medicaid is for people who aren't out there looking for a job or for something else, when in fact over 65% of the funding associated with Medicaid is going to long-term care and to people with disabilities.
Well, what kind of impact will this sort of reduction have on long-term care?
It's going to have significant reductions on long-term care, because not only with long-term care and hospital care, but in long-term care, 4% reduction comes on top of a 10% cut that those institutions received from the federal government last October as part of the federal budget for cutting their Medicare payments by 10%. So it's going to have a dramatic impact on long-term care facilities, but then also have a corresponding impact on hospitals. Because if it's harder for people to get into a long-term care facility, that causes patients to get backed up in hospitals where it's more expensive to be able to find organizations that will accept those patients.
Wow, that's what other sort of reductions are we going to see from the governor's proposed budget?
One of them that has the biggest impact on our South Jackson Street Hospital, Schuylkill Medical Center, South Jackson Street. We're the only OB provider, obstetrical provider in Schuylkill County. We do over 1,100 births a year, which is as many of the tertiary centers around us. But 52% of the births that we have here at Schuylkill Medical Center, South Jackson Street, come under the Medicaid program. And one of the items that's in the state budget currently, actually to possibly get in for this fiscal year yet, ending June 30th, is a payment elimination for normal newborn care to hospitals. To impact us on an annual basis is $410,000.
So when you say normal newborn care, are you talking the ones that aren't difficult births or premature? It would just be the average birth? The average
birth. The average birth. And that impact to this hospital alone is $410,000. So out of the $5 million reduction that the Commonwealth is looking at associated with normal newborn payments to hospitals, we represent almost 8 to 9% of that at $410,000.
Now, I have to ask you, because I would ask the higher education people or anybody else who's seeing a reduction in state funding or even federal funding, what sort of belt-tightening measures have hospitals taken over the last couple of years? Because the economy has been rough. You have to have known that there were going to be you're going to be facing with some sort of reductions.
Right. Again, it's important for the public to understand that hospitals everywhere, and especially in rural settings actually have the highest percentage of Medicaid than cities. So higher percentage than Philadelphia and Pittsburgh, located in rural settings throughout Pennsylvania. And so hospitals throughout Pennsylvania, not just like us here in Schuylkill County, a rural setting, we've had to do everything. Cutting expenses associated with supplies, changing benefit structure for our employees so that we could deal with the cuts that have occurred already on the federal side, but also changes in reimbursement on the state side also.
Now, is there a lot of competition between hospitals in Pennsylvania for the funding?
Well, from funding associated with Medicaid is done on a statewide
formula basis
throughout the state of Pennsylvania. So those who are getting their Medicaid payments are getting them because of the amount of Medicaid business that they do. But there are disproportionate share hospitals, and our South Jackson Street Hospital is one of those that receives on an inpatient basis an additional amount of money because it does a disproportionate amount of health care to the medical assistance population. But the medical assistance population that we take care of here at Schuylkill is beyond just normal newborn and beyond just medical and surgical patients. We also have behavioral health. We're the only behavioral health provider in Schuylkill County. And we actually take a much larger market associated with behavioral health and OB, larger even than Schuylkill County. And we're concerned about these continued cuts associated with the Medicaid program, because a high percentage of our overall business in behavioral health also comes from that area. We're also the only drug and alcohol program in our county, and we're concerned about the cuts associated with block grants to counties, and the proposed budget has a 20% reduction in payments to counties associated with human services and drug and alcohol and MHMR and children and youth, and many of the items that will come under human services are going to be under attack in this budget.
Well, we have a lot more questions to ask you, but we'll be back in a moment with an additional segment on Behind the Headlines.
Behind the Headlines is brought to you as a public service by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The Council works aggressively to define key long-term policy strategies and solutions that make the Commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Hospital and Health System Association of Pennsylvania, helping hospitals to provide healing, health, and hope to communities across the state, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States. And by Penn Waste, your best local choice for your waste removal and recycling needs.
Welcome back. We're here again in Pottsville, Pennsylvania, and we're continuing our discussion with the CEO of the Schuylkill Health System. And I know that across Pennsylvania, hospitals and health systems create over 500,000 jobs, statewide. And they have a pretty significant economic impact. I believe it's $40.1 billion in direct money into the state. That's huge. So why don't you tell me a little bit about the impact in this area that this health system has, just in this general area of Pottsville?
Sure. We employ close to 1,400 people. We're the largest employer in Schuylkill County, our two hospitals and the different parts of our health system, with over the average salary over $45,000 and with very good benefits for our employees. And our own economic impact is approaching $150 million as part of our organization, a payroll about $70 million, but the economic impact in our community that generates close to $300 million on its ripple effect. So we are a major, not only employer, but a major economic source for our county. We're a job creator by having a school of nursing and also an affiliation with many other universities for education. We have a radiological technician program with Penn State Schuylkill. We have other relationships with other organizations, DeSales University in Allentown for physician's assistants, King's College for physician's assistants, Commonwealth Medical College for medical students. So we have relationships with many to be able to not only employ people here as part of our health system, but also to create jobs for people not only as part of Schuylkill, but we are the major employer or the major creator of nursing jobs in particular for our region. Well,
and we're really in the heart of central Pennsylvania here, yes. And you're having a significant impact in this particular region, and it's way outside of the urban areas where the impact would be, I would imagine, really, really significant too on a statewide basis.
Yes, it is critical in every part of the Commonwealth that hospitals or health systems are probably in the top 3 employers in every county in Pennsylvania. So we take that seriously as being an employer and a good employer. And we're proud of the fact that our workforce has been very strong, and that the fact that we can still create jobs. We are a job creator. And one of the parts of the governor's budget is being, supporting job creators. Hospitals and health systems are probably one of the strongest job creators, and have been even during the economic downturn over the past 3 years in Pennsylvania. It's one sector that was not as impacted as badly as others.
Right.
So in spite of the fact that people like our organization and organizations throughout the Commonwealth have had to do things to tighten their budgets, to deal with a downturn in the economy, because when people lost their jobs, then many of them lost their health care insurance. We've done what we could to eliminate costs everywhere else in our organizations that we can. But when we don't receive proper reimbursement on Medicaid in Pennsylvania does not cover the cost, both on an inpatient basis and the outpatient basis, of the cost of care to patients, any reduction is only providing an opportunity for more harm to those who are providing the most care to that community.
And would you anticipate perhaps some job loss with the governor's proposed budget?
If there wouldn't be job loss, there would definitely be a job curtailment as far as not adding more people to be able to deal with these particular issues. But I'm really concerned on the normal newborn, the impact upon women.
Right.
I hope we never have to do it, but if we did have to do something with our obstetrical unit, as many hospitals, 47 hospitals have closed OB units in Pennsylvania since 1995, that would have a dramatic impact on our region. So we're concerned about why some of these cuts and how the people in Pennsylvania realize what that impact would be in their communities.
Well, if the governor were sitting right here in my place and you had the opportunity to say to him, Governor Corbett, don't do this, what would be the 3 top points that you would make to him regarding specifically Medicaid, because that seems to be the area that's going to have the biggest impact? What would you want the governor to know, and all of Pennsylvania to know?
Well, first of all, hospitals accept everyone who comes through their doors. Doesn't matter if they're Medicaid, Medicare, or some other form of health care insurance or no insurance. We're the only industry in the United States that when a person comes in their doors, that they can be assured that their hospital is going to take care of them. And I think that the governor and others have relied upon that in the past as being that, the hospitals will figure out a way to do it. Well, what they didn't figure out is a bad economy and the impact that it would have on hospitals over the past 3 years, but also the changes that have come through on the federal side. I mean, dramatic cuts in Pennsylvania alone is going to be over $10 billion to hospitals over the next 10 years associated with the ACA, the Affordable Care Act. So it's very important that people realize there isn't a way to get this money from somewhere else too. I think that many times that people say, well, hospitals will just shift that cost to employers or shift that cost to somewhere else.
Somebody has to pay for it.
Somebody has to pay for it.
Yeah.
But the reality is that hospitals are in contracts with insurance companies. We can't go and get more money from an insurance company because the government, in this case Pennsylvania, doesn't want to pay us for providing a service. So if the government doesn't pay us for adequately associated with providing that service, I can't go to Blue Cross or Blue Shield or to another insurance company and say, the Commonwealth doesn't want to pay us for this. You need to do that. It doesn't work that way. Okay.
Now, you mentioned, as you were just speaking there, that a lot of the people who have lost their jobs are actually those people who are now recipients of Medicaid. What does that look like in Pennsylvania right now?
In Pennsylvania, it's about 18% of the overall population in Pennsylvania is receiving Medicaid, so either through long-term care or through care as part of their medical benefits. And we saw that it's really a big impact in Schuylkill County, that in 2008, when unemployment was about 7.5% in Schuylkill County and it peaked over 11% at the worst part of the economy, we actually saw a change of almost 5% in our medical assistance portion of our business. And what happens is that people who had jobs and were being employed many times had insurance through their employer or were able to buy insurance on their own. But when they lost their job, Medicaid became the insurer of last resort. So I would agree with the governor and I would agree with the legislature that we need to create jobs, but we need to create sustaining jobs where people can afford to pay for health care insurance or have health care insurance provided to them. But in the meantime, you can't go and cut hospital payments to provide care to this population.
Well, you mentioned the Affordable Care Act. I imagine we could probably do an entire show on that. And the Supreme Court is going to be dealing with it, ruling on it soon. And you said it's had a significant impact on hospitals. Do you have any? If you had a crystal ball, what do you think is going to happen?
Well, you know, the big question will be the portion related to the individual mandate, and whether or not can the government impose on a universal basis that everyone has to be covered by insurance, and whether or not if it's through the states or through them purchasing that themselves. So I think that'll be the big question. The question or the comment that I would make in relationship to hospitals is that hospitals committed as part of the Affordable Care Act to $150 billion worth of cuts to the Medicare program over the next 10 years as part of that already. The big concern that we have is that obviously if those cuts are in place and have been in place since April 1st, 2010.
Wow.
So the first cuts came April 1st, 2010. Second one was a change on July 1st, 2010. The next one was October 1st, 2010, and then October 1st, 2011. But those cuts will continue over the next 10 years.
So is this over and above what's been happening, it's in the governor's proposed budget?
Yeah, because the governor's is on Medicaid.
Okay.
And this is on Medicare.
Medicare, okay.
Right, but the Commonwealth is also concerned about what happens in the future, that if they have to expand and provide coverage to about the 9 to 10% of the population in Pennsylvania that doesn't receive Medicaid but might qualify under the Affordable Care Act, how to pay for that. But that decision is probably going to know this summer, but at this point in time that would not go into effect until 2014.
Right.
So there's a
time to get ready.
Time to get ready, but at
if it's upheld, of course.
If it's upheld,
yeah.
But at the same point in time, that's something that hospitals are concerned is that if we have the cuts, but we don't have people getting health care insurance who don't have it now, that continues us in the same way, high uncompensated care for what we have to do. And that's something that's not sustainable of continuing to have as much uncompensated care as hospitals have been having.
As the CEO of a pretty significant health system here, what keeps you up at night?
You know, I think not having predictability in the fact that we are a large employer, worrying about our employees and making sure that we're doing right by our employees and their families, but not having the predictability. Both on governmental payments, both either from the state or from Washington, and not knowing what that future is. Our fiscal year runs July 1st through June 30th. States is the same, federal government's is October 1st, but here we are in late March, and we're not sure what's going to happen in June and what's going to happen next October in Washington. So predictability would be something that would be wonderful to have.
You'd sleep better.
Sleep better, but it would also make sure that our employees know that we're doing everything possible to preserve their jobs and to deal with a tough time when we're seeing such shrinking reimbursement from these payers.
You sound like you could be the CEO of any company in Pennsylvania right now. I think predictability is one of the biggest challenges from the federal government, from the state government too. So you're not alone in your sleepless nights. In our last minute here, we have a beautiful day here in Pottsville. Tell us about some of the major. I know one of the major attractions. Why don't you tell us just one of the best parts about Pottsville that people might not know?
Well, obviously, the Pottsville is a great community, and you alluded to it earlier when we were discussing that we are the home of Yuengling beer, and
we have to get that in there.
Yeah, Yuengling Live. So thanks, Dick, or thank you, Dick. Thank myself to you for getting that in, but. You know, it's companies like Yuengling that have been here for since the early 1800s and have been providing also stable employment that we're proud of what they do here locally, but also many other companies. We in Schuylkill County, we're a large big box companies are located here. Wegmans, Lowe's, Big Lots.
Love Wegmans.
All the distribution centers, many of them are located here in Schuylkill County because of our infrastructure associated with highways on the interstate system.
Well, we want to thank you so much for being with us today and shedding some much needed light on Medicaid and Medicare and the governor's proposed budget. And we wish you the best as you face this budget season.
Thank you very much.
We'll be back with another segment of Behind the Headlines next.
Behind the Headlines is a production of the Susquehanna Valley Center for Public Policy, a nonpartisan, nonprofit research organization helping Pennsylvania build a brighter future.
Welcome to a new segment on Behind the Headlines. We have a special edition here on location in Hershey, Pennsylvania for National School Choice Week, sponsored by the Americans for Prosperity Foundation. And we're really thrilled to have with us Mr. Dick Morris, who's a former Clinton advisor and a current Fox News contributor.
Right.
Thank you so much for being here. My big burning question for you is, what can Pennsylvania do? What should Pennsylvania do to move school choice or school reform forward?
Good. Well, I've just spoken at a conference on school choice here in Hershey, and we drew, I think, 350 people, which was just terrific.
Yes.
Every other state is moving ahead with school choice but Pennsylvania.
Oh.
Wisconsin, Indiana, Ohio, Tennessee, Louisiana, Oklahoma, Idaho, Florida, New Jersey have all enacted significant school choice legislation.
Why are we lagging
Even
behind?
New York did. And Pennsylvania has done nothing. And frankly, it's because the Republican Party that controls the governorship and both houses of the legislature has totally dropped the ball. Governor Corbett, who promised to be for school choice, says the right things, but then isn't leading on this issue. The legislature is coming back into session, I think, next week, and the governor has got to get out in front and start pushing for school choice. And I hope that anybody who's watching this show who supports school choice will get in touch with their legislator, particularly if he or she is a Republican, and say that unless you get on board for school choice right now, we're going to fight you in primary fights against real advocates of school choice. It is outrageous that after the voters put in power a pro-choice government on education, that it has done absolutely nothing to move down that road. The state Senate passed a bill, but the state House has not. And the governor has not exerted the slightest ounce of leadership on this issue. And Governor Corbett needs to get off his butt and do this.
Well, I think he's going to get your message loud and clear. Well, thank you so much. I want to ask you just briefly, we're
By the way, I campaigned for Corbett. I did fundraisers for him.
Oh, so he knows you well.
Yeah.
He knows your number. We're in primary election season.
I believe that Senator Casey is an endangered species.
Do you?
And I worked for his father. I ran his father's first campaign in 1978.
Good.
I met him above a Chinese restaurant in Scranton where his office was.
A Chinese restaurant.
Yeah. And he was great. But his son is not. His son, I think, is a dismal failure. He sells himself as a conservative because he's pro-life. But on everything else, he's very liberal. And even on abortion, he has only a 50-50 record. So I think he can be defeated. I think the state party just made a huge mistake in endorsing Welch for this position. Welch voted for Barack Obama in 2008 and voted for Sestak for Senate against Pat Toomey. So I think that this is a serious mistake, and I'm going to be supporting Tom Smith, who is going to be opposing him in a primary fight, and I hope Smith wins because it would be nice to have a Republican candidate.
Yeah, well, it's been a crazy primary season. There have been a lot of ups and downs, changes on a weekly basis. It sounds like Pennsylvania's no different as we head into our primary season.
Yeah, but the whole country will be depending on you on Election Day.
Oh, that's an awesome burden. Well, we'd like to thank you very much for spending a few moments with us today.
Thanks so much.